Good afternoon, ladies and gentlemen, to our esteemed judges, guests, representatives, and of course, our finalists. Welcome to the Komunidad Kontra COVID awarding ceremony. I am Aliyah from the Sigma Phi Sorority.
And I am BJ from the Sigma Phi Fraternity.
All right, finally, we're all here to witness the excellent community-based COVID-19 strategies of our representatives and find out who among them will stand out.
That's right, Aliyah. Kilos Komunidad Kontra COVID is brought to you by the University of the Philippines, Manila, College of Medicine, and Philippine General Hospital, Department of Family and Community Medicine, Mr. Sultan Picelli Hoson, Xavier School Class 1995, and the Sigma Phi Fraternity and Sorority.
Okay, so to formally start our event, let us all welcome Dr. Alan Janicio, Chair, Department of Family and Community Medicine, Philippine General Hospital, for his opening remarks.
Good afternoon to everyone, and welcome to the Komunidad Kontra COVID awarding ceremony. Most of media attention has been on the role of hospitals in battling the pandemic. And there are many tales of heroism and innovativeness in our hospital system that deserve great praise and gratitude from the nation. But we must acknowledge also that hospitals are really the last line of defense. The actual front line is at the level of the community. It is at the level of the mayors and their executive and legislative teams. It is at the level of the municipal health unit doctors and their RHU teams and their barangay health workers. It is at the level of the barangay health emergency response teams. But most of all, it is at the level of the people themselves. If their potential for volunteerism and their ability to move together against the pandemic are awakened, then the front line will be secure and the hospital line will remain intact and the pandemic will be more easily controlled. But if this front line fails, then the hospital system will collapse and the pandemic will have won. Through these awards, the organizers hope to redress the lack of attention to and acknowledgement of the efforts of the local government units at the front line. The organizers have invited them to tell us stories of what they did, and the best examples have been chosen to serve as models of what can be done together with the people, hopefully to inspire others to follow suit or to develop even better and more innovative models. We thank the organizers, the alumni of Xavier School Class of 1995, the Sigma Phi Fraternity and Sorority, and the community faculty of the Department of Family and Community Medicine of the UP College of Medicine, UPManila, for spearheading this initiative. But most of all, we thank and congratulate the participating LGUs whose stories are truly inspiring. We cannot count the number of lives you have saved, and we acknowledge your efforts. A grateful nation. Thanks.
We thank Dr. Janicio for that very valuable message. Now, let us get a full glimpse of the idea behind this project. Kilos Komunidad Kontra COVID is an initiative that aims to highlight and recognize excellent community-based practices by municipalities all over the Philippines in the prevention and control of COVID-19.
The participating community shall be able to submit a 15 to 20-minute documentary or a lecture video showing the community-based COVID-19 strategy or program of the participating units based on the criteria set by your judges. So to get the full detail about this event, we would like to call on Dr. Anthony Cordero, Director of the Community Health and Development Program of UPManila, to formally introduce us to this relevant and timely initiative.
Okay, so good afternoon, everyone. So the idea started about the middle of 2021 when there were suggestions on holding another search for outstanding community-based initiatives. So because of that, several groups, as already mentioned by Dr. Alan Dionisio, the UPManila College of Medicine and PGH Department of Family and Community Medicine, and Xavier School, class of 1995, and the Mu Sigma Phi Sorority and Mu Sigma Phi Fraternity got together. So, share niyo yung slides. Nakaka-problem dito sa pag-share ng slide. Ayan. So, talk started regarding the possibility of holding another search for excellent community-based public health COVID-19 initiatives. Kasi nagkaroon ng isang competition and there were really some excellent initiatives by different municipalities. Next slide, please. So the aim was to highlight community-based, intersectoral, and interprofessional efforts against COVID-19. And this would be a departure from the usual hospital-centric and physician-centric perspective in the COVID-19 responses. Dr. Dionisio already mentioned this during the opening remarks. Yung laging pinopost natin na football analogy, ba? Yung goalkeeper, yan yung mga hospitals. Pero kailangan natin ng yung mga attacking midfielders saka yung mga strikers para talagang manalo sa COVID-19. And these are the municipal and barangay local government units. Next slide, please. So these four groups decided to collaborate with each other. Na banggit ka na po yan. Next slide, please. And so, pinanganak po yung Kilos Komunidad Kontra COVID. Even with the title, we wanted to emphasize that this was all about community-based initiatives. So next slide, please. So the objective of the Kilos Komunidad Kontra COVID is to highlight and recognize good community-based practices in the prevention and control of COVID-19. Next slide, please. And this different parameters, the different parameters reflect the value system or what was being held important by the organizers. So it considers the comprehensiveness of the strategies, the involvement of community members, the use of local data and other research findings. Yan, 10% po yan ng criteria. Uses local data and other research findings in the development of strategies. Naghahanap po tayo ng mga data-driven decision-making approaches. And of course, the use of yung mga social innovations in health, the intersectoral collaboration, enables participation of grassroots community members, addresses other health and development programs. So yung comprehensiveness, the empowering nature of the strategies. Next slide, please. And so, mamaya po, mabibigyan naman po ng recognition, but sobrang salamat po sa 27 municipal LGUs who participated in this year's Kilos Komunidad Kontra COVID. Next slide, please. So the 27 municipal LGUs went through several rounds of assessment and evaluation. So you have here your first round judges. Next slide, please. And then we had our second round judges. And finally, the third and final round judges na ma-announce po later. Next. And today, December 14, 2021, We will recognize the 27 LGUs for their community-based efforts and their participation in the Kilos Komunidad Kontra COVID, and we will of course be announcing the winners. We actually got a total of 4 cities who sent their community-based initiatives and a couple of provinces. So we're thinking ahead to next year that maybe we would have, because we also got recommendations of organizing a Kilos Komunidad Kontra COVID for barangays. So yeah, exciting po, exciting. So maraming salamat.
Thank you, Dr. Cordero, for that introduction and also for your efforts in spearheading this event. And now here we are in the final leg of this project. Let us first recharge ourselves with some inspirational messages from our dearest partners.
Of course, this event will not be possible without them. The University of the Philippines, Manila is always one of the pioneers when it comes to projects concerning health approaches, especially with community-based initiatives. With that, let us all welcome the Chancellor of UPManila, Dr. Carmencita D. Padilla, for an inspiring message.
Magandang hapon po. Sa ngalan ng UPManila, binabati ko ang mga kinatawan ng 27 pamayanang lokal na kalahok sa programang Kilos Komunidad Kontra COVID. Search for excellent community-based COVID-19 strategies. At palugod ko rin binabati ang lahat na kasama natin sa virtual na parangal na ito. Naranasan natin lahat nung simula ng pandemya. Nangangapa tayo kung paano ito pupuksain. Di gaano matatag ang sistema ng kalusugan, lalo na sa mga pamayanan. At halos wala tayong kaalaman sa coronavirus nang ito ay dumating sa atin. Hindi madali ang magplano at magsagawa ng kahit anong programa noon. Nang maglaon, itagdag natin sa hirap ang patuloy na pagbabago ng virus, bunga ng mga variants at mutations na may malaking epekto sa mga plano at programa. Ang tugon ng mga lokal na pamahalaan sa pagsugpo ng pandemyang COVID-19 ay napakahalaga. Hanggang nagsasakatuparan ang pambansang pamahalaan ng mga malalawak na blanket policies o patakaran upang masugpo ang pandemya, isinasaalang-alang ng mga LGUs ang mga granular policies at real-time interventions upang matugunan ang pagkakaiba-iba ng bawat lugar at mekanismo sa pagtugon ng krisis. Sa pakikipaglaban sa COVID, kinakailangan ng pagiging alerto, handa at matuling, at sistematikong pagpaplano ng mga LGU. Kritikal sa gawain ng pakikipag-ugnayan sa iba't ibang ahensya at sektor at pagtalima sa mga pambansang alituntunin. Sa loob ng halos 2 taong pakikipagtunggali natin sa coronavirus, maraming programang pangkomunidad ang nangingibabaw at nararapat-tularan ng ibang pamayanan. Ito ay upang higit na mapalakas at mapalawig ang pagtugon ng bansa sa pandemya. Sa palatuntunan ito, ibigyan pugay at parangal ng UPManila at mga katuwang na grupo ang mga mahuhusay at makabuluhang inisyatibo at gawaing pangkomunidad sa pag-iwas at pagpigil ng COVID-19. Ngayon ang pagkakataon upang pagtuunan ng kaukulang pansin ang mga nagwaging programa. Tunay na kahanga-hanga ang kanilang mga naisagawang mga hakbang upang labanan ang COVID sa komunidad tulad ng pagpapabuti ng sitwasyong pinansyal at manggagawa ng pangkalusugan. Paggamit ng malikhaing estratehiya, lokal na datos, at resulta ng pananaliksik sa pagpaplano, pakikipag-ugnayan sa ibang institusyon at mga nasa grassroots, pagpapanatili o sustainability ng pagrespeto sa kultura at karapatang pantao. Nagpapasalamat tayo sa UPManila College of Medicine, Philippine General Hospital, Department of Family and Community Medicine, Xavier School Class of 1995, kasama na rin ang Sigma Phi Sorority at Sigma Phi Fraternity sa pagiging katuwang ng UPManila sa programang ito at sa paghirang ng mga nagwagi. Masigabong pagbubunyi sa inyong lahat. Nawa ay patuloy kayong maging inspirasyon, patnubay at tagaambag sa isang komprehensibo, makabuluhan, at nakabatay sa agham na tugon ng ating bansa sa pandemya. Maraming salamat po at magandang hapon muli sa inyong lahat.
Thank you so much for that wonderful message, Chancellor Padilla. Sobrang inspiring talaga, no, Aliyah?
Tama ka dyan, DJ. It is indeed very inspirational. So another reason why this event became possible is through the joint efforts of the new Sigma Phi Sorority and Fraternity in fostering one of its exemplary pillars, service. For that, we would like to call on the most illustrious sister of the new Sigma Phi Sorority, Ms. Kyle Maxine Romero, batch 2022, for a heartwarming message.
Hello, good afternoon po to everyone. First of all, on behalf of the new Sigma Phi Sorority, I would like to thank everyone for attending today. To all of our participating LGUs, thank you so much for joining us. To our judges, thank you. And of course, to our wonderful partners, the Department of Family and Community Medicine, our brother fraternity, Xavier School Class of 1995. Thank you everyone for being with us on this journey. I'm sure we're all going to learn a lot from each other today, and I'm so excited for everyone to see the entries that will be shown. It is honestly so heartwarming to see the projects, seeing everybody work so hard, and more importantly, seeing everyone work together in spite of the very difficult past years that we have had. The pandemic has been a very frustrating situation for all of us, but it fills me with hope, knowing that we have leaders like you in our communities who, where others see problems, you have created solutions. You guys give us hope that we will one day finally be able to greet each other with hugs and without masks again. And you inspire us to do better as members of our own communities towards achieving that goal. It was an honor to witness, albeit virtually, what you have done, and may this continue to inspire others, and may we continue to support each other in our endeavors such as this. Let us continue to work together in the service of the Filipino people. Thank you again, everybody, and stay safe.
Thank you, Sis Matthew, who would also like to hear some words of inspiration from the most exalted brother of the new Sigma Phi Fraternity, Rod Matthew Aling Hernandez, batch 2023. To everyone here, we're sorry we're having a few technical difficulties. We're just waiting for Broad Matthew to enter. Thank you. For now,
Hello? Ayan, sorry.
there.
Okay. Magandang hapon po sa lahat. Salamat po sa pag-attend. Okay ko lang. So magandang hapon po sa lahat ng ating mga kalahok at panauhin. Salamat po sa bawat isa sa paglalaan ng oras para makasama sa pagdiriwang ng ating mga local government units na nagsusumikap na gawing mas ligtas sa tirahan ang kani-kanilang mga komunidad. So ang nakalipas na 2 taon sa pandemyang ito ay napuno ng hindi mabilang na pagkamatay, dismayang desisyon na mula sa mga gobyerno at maruhong na pagsigaw para sa mabuting pagtugon sa pandemya. Ngayon dito sa Kilos Komunidad Kontra COVID, nakikita natin ang isang panibagong pag-asa. Mga lokal na komunidad na nagsusumikap upang tugunan ang mga isyong pangkalusugan, pang-ekonomiya at panlipunang dala ng pandemya ito. Sa pamamagitan ng KKKC, nasaksihan natin kung paano ang mga munisipalidad sa iba't ibang bahagi ng bansa ay maaaring magsilbing inspirasyon sa panahong ito ng pagsubok. Pinakita ng ating 27 na mga kalahok sa Kilos Komunidad Kontra COVID ang kanilang mahusay na mga gawi sa komunidad laban sa COVID-19. Nasaksihan namin sa inyong mga entry ang kahalagahan ng lokal na pamahalaan sa paglaban ng pandemyang ito. Kailangan natin palakasin ang mga lokal na sistemang ito na siyang paunahing naghahatid ng serbisyo, nangangalaga at tumutulong sa mga tao upang gawing mas ligtas ang kanilang mga komunidad. Nakita din namin kung paano nagsama-sama ang iba't ibang institusyon upang pigilan ang impeksyon ng COVID-19 at magbigay ng mas mabuting kondisyon para sa kanilang mga mamamayan. Hindi lang ang healthcare workers at local government units ang nasa larawan, kundi pati na rin ang mga kapulisan, mga guro, manggagawa at mga kabataan. Isang paalaala sa atin na tayong lahat ay may mahalagang papel sa pagwawakas ng krisis na ito. Nais kong batiin ang lahat ng ating mga kalahok na may patuloy niyong protektahan at alagaan ang inyong mga mamamayan. Umaasa akong mas marami pang LGU sa buong bansa ang tumulad sa mga pagbabagong ginawa ninyo sa inyong mga komunidad. Nais ko rin ipaalala sa lahat na ang pandemyang ito ay hindi pa nagtatapos, ngunit ang pag-asa ay nanatili lamang sa bawat isa sa atin. Mula sa Sigma Phi Fraternity at Sorority, nais kong pasalamatan ang Department of Family and Community Medicine ng Philippine General Hospital, Xavier High School Class of 1995, at lahat ng mga tumulong para magawa ang proyektong ito. Special mention din sa aming mga broads na si Dr. Anthony Cordero at Dr. Rinaldo Hoson sa napakalaking suporta at tulong na binigay niyo sa amin. Muli nagpapasalamat ako sa lahat ng ating mga panauhin ngayong hapon. Maraming salamat at manatili tayong ligtas. Stay safe everyone.
Thank you, Rod, for that message. And once again, to the UPPGH Department of Family and Community Medicine, the new Sigma Phi, Mr. Sultan Pacelli Hosan, and Xavier School Class 1995 for organizing this event. But above all, this project would not be possible without an initiative from people who have generous intentions in raising awareness about the importance of community-based public health strategies. And with that, we would like to call on Dr. Reynaldo Hosan, faculty retiree from the UP College of Medicine, a Xavier School alumnus and a member of the new Sigma Phi Fraternity batch 1974, to give us a final message from our dearest organizers.
Good day. I am not an infectious disease specialist. I am not a public health specialist. I am not a COVID-19 specialist. What is my role in the 2021 Kilos Komunidad Kontra COVID, or KKKC? Financier for Contest Cash Award? Yes, yes, yes. An advocate to recognize the importance of rural health and municipal health officers in the fight against COVID-19 and to assist them. Yes, 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 yes. 5 yeses. I am a community-oriented surgeon by profession. I have retired from the UP College of Medicine, Philippine General Hospital in UPManila in 2014 at age 65. In March 2020, at age 72, I was forced to stay home because of my senior citizen status. However, I made a resolution to help in the COVID pandemic crisis. With the help of my classmates in Xavier School, Batch 66, my friends, relatives, and patients, I was able to raise more than 2 million pesos to give about 50,000 pesos worth of PPEs to at least one rural health unit or provincial government hospital in all the provinces in the Philippines. There was a total of 79 beneficiaries. I collaborated with Help Through Philippines and the new Sigma Phi Fraternity and Sorority in this project using new Sigma Phi coordinators throughout the country. In July 30, 2020, I gave out 6 incentive awards worth 150,000 pesos to the best community practices against COVID-19 among the new Sigma Phi coordinators. With the COVID-19 crisis still raging after the initial projects, I next focus on incentivizing the rural health officers, municipal health officers, and doctors to the barrios, as I believe they played a very crucial role in the fight against COVID-19. Together with the new Sigma Phi Fraternity and Sorority, I again sponsored an incentive award contest in October 2020. The title was The Search for Community-Based Innovations and Best Practices for Health in the Time of Pandemic. Unfortunately, there were no takers, no submission of entries. Probably the MHOs were already very, very tired in controlling the COVID-19 in their communities. Instead of giving back the donations that I got or channel it to other things against COVID-19, since I believe the community frontliners should be recognized, note there was an honoring of hospital frontliners in 2020, none for the community practitioners. I decided to ask Dr. Delen de la Paz and Dr. Anthony Cordero for help. Thanks to them, they agreed. The rest is history. The University of the Philippines, Manila, Department of Family and Community Medicine, sponsoring the event, and finally giving recognition to the importance of community-based public health initiatives against COVID-19, as well as to give recognition to the community frontliners, specifically the municipal health officers. Thank you, Delen de la Paz, Hans Cordero, and the UPManila Department of Family and Community Medicine for making my dream come to fruition. Thank you, Xavier School Class 95 and the new Sigma Phi Fraternity and Sorority for the sponsorship. To everybody, I wish you all a very, very fruitful learning conference today.
That message was truly inspiring coming from Dr. Hoson. Thank you so much again for this initiative and for allowing our participants to showcase their respective community-based projects against COVID-19.
Tama, BJ, we would also like to extend our gratitude to our dearest participants for showing us a relevant and effective community-based public health strategy to promote health and prevent COVID-19. So with that, let us acknowledge each participant, starting with Alfonso Cavite.
So the certificate of participation is proudly presented to Alfonso Cavite for their outstanding participation in Kilos Komunidad Kontra COVID, given this 14th day of December on the year 2021 via Zoom. Signed by Dr. Alan Arjunicio, Chair of the Department of Family and Community Medicine, UPManila, Mr. Benjamin K. Valdez, Bearer of the Staff for fiscal year 2021 to 2022 of Mu Sigma Phi Fraternity, and Ms. Rona T. Villas, Service Community Chairperson for fiscal year 2021 to 2022 of the Mu Sigma Phi Sorority.
Thank you very much and congratulations, Alfonso Cavite. We would also like to award the same certificate to Balayan, Batangas.
Baliwag, Bulacan,
Banton, Romblon,
Bauco, Mountain Province,
Binangonan, Rizal,
Bocaue, Bulacan,
Bontoc, Mountain Province,
Cardona, Rizal,
Kasiguran, Aurora,
Del Carmen, Surigao del Norte,
Diplahan, Zamboanga, Sibugay,
General Luna, Quezon,
Giginto, Bulacan,
Gipos, Zamboanga del Sur,
Jordan, Guimaras,
Calibo, Aklan,
Kawit, Cavite,
Mangaldan, Pangasinan,
Mendez, Cavite,
Moncada, Tarlac,
Pagsanhan, Laguna,
Pakil, Laguna,
Tikit, North Cotabato,
Sagbayan, Bohol,
San Miguel, Zamboanga del Sur,
and Taytay, Rizal.
Thank you very much again and congratulations to all of you.
And now, for the much-awaited part of the event, let us all watch and learn from the video presentation of our 6 finalists. In alphabetical order, let us watch this presentation from the municipality of Baliwag, Bulacan.
Sa tulong at dedikasyon ng team ng Bayan ng Baliwag, naging mas madali ang pagharap sa COVID-19, maging ang transisyon natin sa new normal. Habang nakababa ang lockdown, siniguro ng pamahalang bayan na walang magugutom sa Baliwag kung kaya isang pamilya at hindi household ang nakatanggap ng ayudang pagkain sa 5 beses na pamamahagi ng serbisyong may malasakit food packs. Nagpatupad rin ang pamahalang bayan ng karagdagang programa para sa mga sektong na nangangailangan ng suporta. Nariyan ang libreng sakay para sa hospital frontliners. Namahagi rin ng mask, PPE, alcohol at vitamins para sa mga government frontliners. Nagpatupad din ang bayan ng Baliwag ng regular na disinfection sa mga matao at pampublikong lugar gaya ng Pamilihang Bayan, sa Glorieta Park at sa Star Arena. Namigay din ng lokal na pamahalaan ng libreng paalmusal sa lahat ng barangay sa programang Alum Share, na sinundan pa ng libreng pandesal o pandishare mula sa donasyong harina ng San Miguel Corporation. Dahil bawal ang lumabas, bumuo ang pamahalaang bayan ng Baliwag ng COVID-19 telemed para sa libreng medikal na konsultasyon ng mga mamamayan nito. Para naman sa may kapamilyang nasa ibang bansa at pabalik sa Pilipinas, nagkaroon ng dedicated hotline para sa OFW concierge. Gayon din ang libreng sundo para sa OFWs na nakapagtala ng 115 na kababayang na ihatid ng ligtas sa kani-kanilang mga tahanan. Maging ang mga dialysis patients na kailangan magpagamot noong lockdown ay binigyan ng libreng sakay sa pamamagitan ng programang Patient Transport Service System. Pinagkalooban din ng pinansyal na ayuda na nagkakahalagang 1,000 pesos ang may 5,000 lehitimong kasapi ng TODA at YODA na hindi nakapamasada sa Baliwag. Nabigyan ng pagkakataon ang mga tricycle drivers at displaced workers na nawalan ng hanap buhay na maging delivery riders ng mga essential goods sa bawat tahanang Baliwagenyo. Naghatid rin ng livelihood assistance sa 157 displaced workers sa pamamagitan ng hatid kabuhayan starter kits. Ang health cluster ang tumututok sa coordination sa mga COVID-19 positive, nagsasagawa ng contact tracing, free swab testing services, at monitoring and treatment ng mga naka-admit sa aming Baliwag COVID-19 Malasakit Emergency Quarantine Facility. Gayon din, ang libreng antigen at rapid test para sa mga outpatients at close contacts. Ang economic cluster ang nagpapatupad ng joint inspection assessment para masiguro ang compliance ng mga negosyo sa minimum health protocols. Ang logistic clusters ang nagsasaayos ng mga kailangang supplies at utilities para sa operasyon ng isolation and quarantine facility para sa PUM sa municipal at barangay level. Ang food and non-food cluster ang nagpapamahagi ng food packs and essential items sa mga pamilyang COVID-19 patients habang naka-quarantine ang kanilang pamilya. Ang crisis communication cluster ang nagsasapubliko ng mga napapanahong impormasyon kaugnay ng mga ipinatutupad na alituntunin at pulisiya ng Baliwag IATF. Ang management of the dead cluster ang nag-aasikaso ng pagpapalibing at pagpoproseso ng financial assistance na nagkakahalagang 10,000 pesos para sa mga namatayan at nagbibigay ng debriefing services sa mga kapamilya na apektado ng COVID-19. Ang Peace and Order Cluster ang nagpapatrol para ma-monitor ang pagtalima sa minimum health standards sa pamayanan at malalaking establishments. Ang Governance Cluster ang nagdidisenyo ng mga programa at proyekto para sa episyenteng pagtugon sa laban sa COVID-19. Naglunsad din ang bayan ng Baliwag ng IMSafe na kinilala ng DICT kamakailan bilang 2020 Best in COVID-19 Pandemic Response. Bumuo rin ang pamahalang lokal ng Baliwag Task Force COVAX para manguna sa mga gawain kabilang ang survey and consent, logistics and storage, procurement, manpower recruitment and training, information systems and monitoring and research. Hindi pa tapos ang pakikibaka natin sa pandemyang ito, pero makakaasa kayong hindi rin matatapos ang aming pamamaraan upang mapanatili ang kaligtasan sa bayan ng Baliwag.
Thank you, Municipality of Baliwag, and congratulations for a really great output. Now, let us call on our second finalist, Municipality of Del Carmen, Surigao del Norte, to show us their presentation.
Marigyaw na adlaw sa tanan. Our gratitude to the Kilos Komunidad Kontra COVID program for considering the local government of Del Carmen strategy to be among the top 6 community-based public health initiative against COVID-19. On behalf of Mayor Baby Coro, LG del Carmen is humbled with the recognition and honored of the effort of our health frontliners and community frontliners in keeping us all safe and hopeful in this time of the pandemic. Let me welcome you to our home, one of the 2021 world's greatest places and the 2021 #1 island in Asia, Siargao. Del Carmen is one of the 9 municipalities of Siargao Islands. We have 20 barangays with upland, urban, and island communities. And in totality, we are considered geographically isolated and disadvantaged area. Our community-based program is about multi-stakeholders coming together to discuss the actions necessary to link science, innovation, policy management and behavior to manage and govern COVID response. Our youth highlighted the co-ownership of the community with their involvement in the vaccination uptake campaign through a Youth for Youth strategy. Despite major challenges faced by the perceived adverse effect of COVID vaccines, we have achieved already almost 60 vaccination rate with the effort of the youth leaders. The agreements made from various dialogues focus on achieving zero and voluntary hunger and allowing livelihood continuity while managing the necessary risk. We were confident in our marine resource management and the farming support will help family access food complemented by regular rice subsidies. Jobs and business support must both continue to allow families regular access to cash for their other needs. Together, the stakeholders agreed on public service innovations such as the mobile tabuan with market vendors, farmers and fisher folks, ihatod logistics services with public transport sector, and a lot more. The good programs was backed by legislation for continuity and sustainability such as the Community Farms or Hardinang Pagbabago Ordinance and the Community Savings Group Ordinance. In closing, I call upon the national government to listen to the wisdom of local governments in responding to the crisis, as the local governments also listens to the wisdom of the constituency. We are still in the middle of the pandemic. There are more decisions to be made and innovations to be created. But we will all do this together as one community. Salamat karadyaw sa Juhur. Please stay safe, wear face mask, and get vaccinated.
Thank you, Del Carmen, Surigao del Norte, and congratulations. For our third finalist, let us all watch the video prepared by the municipality of Giginto, Bulacan.
Sa isang igla, nabalot ang buong mundo. Ang dilim hatid ng sunod-sunod na dilubyo. Tila isa bagang mahabang bangungot na gumago sa takbo ng ating pamumuhay at kumitil na rin ng maraming buhay. Pero tulad ng dati, minaludan tayo ng iba't ibang pagsubok. Nalampasan natin ang maraming hamon. Tulad ko, tulad ng bawat Isipteño. Diba, matapos ang pagkadapa, babangon ka, babangon tayo.
Ituring ang iyong sariling tagahawi ng ulap sa kalangitang kulimlim. Kampanang yayanig sa bawat nilalang magigising ang lupang kulang sa dilim. Ikaw ang magsasabing kaya mo to. Tulad ng isang tanglaw sa gitna ng bagyo. Sigaw mo sa hangin, tumindig at magsilbing liwanag, liwanag sa dilim. Harapin mo, magiting ang bagong awitin. Ikaw ang liwanag sa dilim. Whoa, whoa. At sa paghamon mo sa agos ng ating kasaysayan, uukit ka ng bagong daan. Oh, oh. Ikaw maawit ng kaya mo to. Isang panalangin sa gitna ng bulong. Isigaw mo sa hangin, tumingin at magsilbing liwanag, liwanag sa dilim. Harapin mo, magiting ang bagong awitin. Ikaw ang liwanag. Sigaw mo sa hangin, tumindig at magsilbing liwanag sa dilim. Harapin mo, magiting ang bagong awitin. Liwanag. Sigaw mo sa hangin, tumindig at magsilbing liwanag sa dilim. Harapin mo, magiting ang bagong awitin. Liwanag sa dilim. Liwanag sa dilim. Liwanag.
Thank you so much for that super informative video, Giginto, Bulacan. For our fourth finalist, let us welcome the municipality of Mendez, Cavite.
Magandang araw po sa inyong lahat. Ito po si Mayor Eric Lida mula po sa munisipyo ng Mendez dito sa lalawigan ng Cavite. Ako po ay bumabati sa inyo ngayong araw na ito sa okasyon ng awarding ceremony ng 2021 Kilos Komunidad Kontra COVID. Ito ay isang sabihin na natin paligsahan para makita at mailako yung magagandang mga respondent o pagtugon ng iba't ibang komunidad laban sa COVID-19. Tulad nga po na nailahan na namin dito sa bayan ng Mendez at ulit namin pinapaalala sa lahat. Ang laban sa COVID-19 ay hindi laban ng medical lamang. Ito ay hindi usaping medical lamang na ang solusyon ay medical. Ang usapin po ng COVID ay lumabak na ang saklaw na apektuhan na mo lahat ng aspeto ng ating buhay. Aspeto sa edukasyon, aspeto pang ekonomiya, aspeto pang kalusugan. At yan lalo na po yung aspeto ng pakikisalamuhan natin sa isa't isa. Kaya nga po sa pagtugon natin dito, kailangan ng pagtugon ng lahat. Kailangan po ang pagtugon ng buong pamayanan. Kailangan na po ang pagtulong-tulong ng iba't ibang sektor. Kagaya lang po sa pagbabakuna, sa sistema po ng pagbabakuna. Ang konsepto po na ito ay usapin lamang ng mga nurse, ng mga medical workers, ng mga doktor, at ng iba pang direktang nakikilahok sa vaccination ay mali. Dahil ang pagbabakuna ay usapin at suliranin ng buong bayan. Kaya po, ang solusyon ay manggagaling din sa buong bayan. Tandaan natin, dalawa lang ang bahagi dito sa ating paglaban sa COVID-19. Una-una, ikaw ba ay kasama sa problema na nagpapalala ng COVID-19 o ikaw ay kasama sa solusyon? Mga minamahal kong kababayan, dito sa pamayanan ng Mendes Nunez, nayakap na namin ang responsibilidad. Lahat ng bahagi ng aming lipunan, lahat ng medisenyo, niyayakap ng responsibilidad na lahat ay kasabi sa laban sa COVID-19. Kaya, mas maayos, mas matiwasay, mas kaaya-aya ang nagiging resulta ng aming laban sa pandemya ito. Hindi pa matapos, nakikita na natin, nawawalaan na natin ang liwanag sa dulo ng kapiliman na dulo ng COVID-19. Kaya ipagpatuloy pa natin, kahit tayo, sabihin natin ay nakakalagpas na, malapit na doon sa liwanag na ating inaasam, meron pa rin, tuloy pa rin ang laban. Kaya kailangan lahat ng sektor, lahat ng bahagi ng lipunan, magtulong-tulong pa rin. Kailangan dito, sama-sama, tulong-tulong. At sa ganitong paraan, palalagpasan natin ang pandemya ito. Ito po, si Mayor Elvida mula sa pamayanan ng Mendes, kasama po sa alam po ng lahat ng katuwang ko dito sa pamayanan ng Mendes, ang aming municipal health officer na si Dr. Rosie Veridiano, lahat po ng kanyang mga kasama sa aming rural health unit, at lahat po ng mga volunteers, lahat po ng ibang personnel ng local government unit of Congress na nagtutulong-tulong. At sa kanan po ng lahat ng medisenyo, bumabati po kami sa inyo ng isang magandang araw at maraming salamat.
Congratulations and thank you for showing us your empowering presentation, Mendez Cavite. Let us now call on our fifth finalist, the municipality of Moncada, Tarlac, to show us their output.
Tunay ngang nagbago na ang pandaigdigang digmaan mula sa armadong tunggalian sa pakikibaka upang magkaroon ng matibay na estratehiya at magpatuloy bilang isang nagkakaisang komunidad na mapagtatagumpayan ang laban kontra COVID. Pagod, bigati at luha ang bumuhos sa pagtutok ng pandemya. Ngunit tulad ng yakap ng isang ina, ang bawat haplos ng kalinga at malasakit para sa isa't isa ang nangibabaw upang magpatuloy sa laban. Halina at tunghayan kung paano niyakap ng buong bayan ng Moncada ang bawat isa patungo sa paglayang ating inaasa. Ang ehekutibo kasama ang sangguniang bayan ay nagpatupad ng mga ordinansa upang agarang makatulong sa pagpigil at paglaganap ng virus. Higit pa rito ay sinigurado ng lokal na pamahalaan na hindi mapapabayaan ang lahat ng Moncadenyan sa panahong lahat ay naghihirap dahil sa lockdown at pagsasarana sa pagpapaabot ng mga relief packs sa ating mga kababayan. Katuwang rin natin sila sa paunti-unting pagbukas ng ekonomiya. Maliban pa rito ay ang walang pagod na suporta upang makauwi ang ilang locally stranded individuals at mga OFWs.
Ngayon kasi yung trabaho sa kalamakayan doon, kung tinatanong yung pinagtatrabaho namin doon, nag-isama sa amin, masaya at nakauwi na kami. Nakikita na namin. Pero pagkasawa niya, sumundo sa amin, nakauwi namin sa Moncada.
Siniguro rin ang pamamahagi ng totoo at tamang impormasyon na makaabot sa bawat sulok ng bayan. Inilusad din sa bayan ng Moncada ang electronic Moncada application na magpapadali sa mga transaksyong pang-ekonomiya, pang-pamilya at pang-kalusugan. Unay rin ay pagmamalaki ang agarang pagpapatayo ng COVID-19 treatment facility. Sa gitna ng pandemya ay binigyang din ng bayan ng Moncada ang kaayusan, kapayapaan at ang kahalagahan ng karapatang pantao. Hindi naman magpapahuli ang kagawaran ng pangkalikas at pangkapaligiran upang malabanan ang bantang hatid ng pandemya. Hindi rin matatawaran ang walang tigil na pagsulong sa kalidad ng edukasyon para sa lahat ng mag-aaral. At higit sa lahat, bilang isang komunidad na nagnanais manalo sa laban kontra sa kalabang hindi nakikita, ibinuhos ng bayan ito ang lahat ng makakaya upang mapalakas ang pwersa ng sektor ng kalusugan. Lahat ng ito ang bumubuo upang mapagtagumpayan ang laban sa sakit na kumitil na ng napakaraming buhay. Maraming bayan na ang sumuko, ngunit ang bayan ng Moncada ay mananatiling matatag para sa lahat ng taong nasasakupan nito. Madilim man ang daang tatahakin, ngunit ang init ng yakap ng bawat isa ang magiging ilaw upang makatawid ang isang malayang pamayanan.
Thank you so much for that video, Moncada, and congratulations. We are now on our last entry for today. So let us all welcome the municipality of Taytay Rizal and enjoy their presentation.
Mahigit isang taon na nang sumailalim ang ating bansa sa mahigpit na restriksyong dulot ng pandaigdigang pandemya na kasalukuyan pa rin nating nararanasan. Dahil dito, lubos na humina ang ating ekonomiya. Sa kabila ng walang kahandaan sa hindi inaasahang pangyayari, ay hindi tumigil ang bayan ng Taytay na tugunan ang mga kinaharap na suliranin. March 21, 2020 nang maitala ang unang kaso ng COVID-19 sa bayan ng Taytay. Ngunit bago pa ito mangyari, ay nagkaroon ng Executive and Legislative Joint Emergency Meeting on COVID-19 Preparedness Plan sa pangunguna ng Taytay Mayor Joy Capula kasama ang mga barangay captain, lahat ng municipal department head upang pag-usapan ang mga hakbang sa maayos na paglaban sa COVID-19.
Tinawag natin lahat ng ating mga LGU executive ng bayan ng Taytay para sila ay saksi, kasama municipal health officer, lahat ng ating mga departamento ay nandito para mag-isip tayo kung anong mga magagawa natin na immediate na panglaban dito sa pandemic na ito. Kung mamagitan ng ating budget office ay nakapaglaan ng pera upang ibili ng 1,200 worth of groceries at ito ay didistribute sa lahat ng mga indigent families sa ating bayan.
Upang maiwasan ang mabilisang pagkalat ng virus, ay nakiisa ang bawat Taytayenyo na manatili sa kani-kanilang tahanan. Kasabay naman ito ang malawakang disinfection, misting at fumigation sa mga pampublikong lugar. Pagbuo ng Municipal Epidemiology Surveillance Unit na responsable sa paghawak ng COVID cases sa ating bayan. Cold storage vaccine facilities, antigen at RT-PCR test at ang pagkakaroon ng paperless contact tracing strategy na makakatulong na mapabilis ang contact tracing, ang Taytay Trail. Sinimulan noong Marso ngayong taon ang pagbabakuna para sa mga health workers na harapang nilalabanan ang virus araw-araw. Sa ngayon ay bukas na para sa lahat ng vaccination category ang pagbabakuna kontra COVID-19. Sa kabila ng mga problemang dulot ng COVID-19, ay may iba pang suliraning nararanasan ng ating mga kababayan. Narito ang mga hindi inaasahang kalamidad na mapaminsala sa kabuhayan ng ating mga mamamayan. Sa mga ganitong pangyayari ay handa ang ating lokal na pamahalaan na maghatid ng tulong at magbigay ng pansamantalang matutuluyan sa mga nasunugan at nasalanta ng bagyo. At ang kaliwat ka ng flood control, drainage and sewerage system project upang maiwasan ang mabilisang pagbaha sa Taytay. Tuloy-tuloy pa rin ang paghahatid ng livelihood programs at sustenance sa sektor ng tela at agrikultura.
Ang maganda kasi sa atin, na-shift natin ang ating garment industry sa paggawa ng PPE at saka mga washable face mask. Mga ECQ at hanggang ngayon, malaking porsyento ng mga PPE ang ginagawa dito sa ating bayan na tayo nagsusupply, hindi lamang sa bayan ng Taytay, kundi sa buong Pilipinas.
Sa sektor naman ng edukasyon ay hindi pa rin tumitigil ang Local Youth Development Office sa pagtanggap ng municipal scholars. Upang muling buhayin ng ating ekonomiya, yung opisyal na ginanap ang contract signing sa gagawing MRT4 sa ating bayan. Ngayong pandemya ay nakita rin ng pamahalaang bayan ang kahalagahan ng teknolohiya sa mas mabilis na paghahatid ng impormasyon sa kanilang nasasakupan. Kaya naman kanilang sinimulan ang Taytayan News, isang online program na naglalayong maghatid ng totoo at mahalagang impormasyon patungkol sa kasalukuyang kalagayan ng bayan. Kaisa ng bawat Taytayenyo ang ating pamahalaang bayan sa pag-ahon at sa araw-araw na paglaban kontra COVID-19.
So before we move on, we'd like to thank again all 27 municipalities that sent the 15 to 20-minute video entries. So after choosing the 6 finalists, they were then asked to make 4 to 6-minute videos for today's awarding ceremony.
Now that we've seen the 46-minute summary videos from our 6 finalists, which are all very relevant and informative, we will now introduce the judges of this event who will decide which among these entries have stood out the most.
So first in our panel of judges is Dr. Eddie Durotan, a member of the National Immunization Technical Advisory Group for COVID-19 Vaccine Public Health under the Department of Health.
Thank you and welcome, Dr. Doratan. Next, we have Professor Roderick L. Salenga, Professor 3 from the UPManila College of Pharmacy.
It's a pleasure to have you here, Prof. Salenga. We also have Ma'am Daisy M. De Los Reyes, Director of the UPManila School of Health Sciences, Extension Campus in Baler, Aurora.
Thank you for being with us here, Ma'am De Los Reyes. Our fourth panelist is Professor Jerome A. Ong, Chairperson of the Department of Social Sciences, College of Arts and Sciences, UP Manila.
Welcome, Professor Ong. Our next judge is Dr. Cora B. Añonuevo, President of Health Teachers Incorporated and a retired professor from the UP Manila College of Nursing.
We're glad to have you here, Dr. Añonuevo. And last but not the least is Professor Pedro Magadan, Director of the UP Manila School of Health Sciences Extension Campus in Tarlac.
Thank you for being with us, Prof. Magadan. Moving on, we are now near the last part and down to the most exciting segment of this event, the announcement of winners.
Agree, Aliyah. I'm sure everyone here is thrilled to know our winners. Although I bet our judges had a really hard time deciding because all of the outputs are truly promising.
Tama ka dyan, DJ. So without further ado, let us call on one of the finalists for Kilos Komunidad Kontra COVID-19, Municipality of Viginto, Bulacan.
Congratulations, Municipality of Viginto, Bulacan. Very innovative talaga ang projects ng ating mga community. Moving on to another finalist, we have Municipality of Mendez Cavite.
Yay! Congratulations, Mendez Cavite. Truly amazing to see how your community helped fight against COVID-19. So ang ating namang susunod na finalist ay Municipality of Moncada, Tarlac.
Congratulations, Moncada Tarlac. Sobrang nakaka-inspire talaga yung mga pinakita ng ating mga LGUs. Sobrang laking props sa lahat ng mga LGUs.
Tama ka dyan, DJ. So now, moving on to our top 3, the big 3 kumbaga. So our third placer will bring home 16,000 pesos. So the second runner-up goes to Municipality of Baliwag, Bulacan.
Congratulations, Baliwag, Bulacan. Super well-deserved. Moving on, our first runner-up who will take home an amount of 26,000 pesos is Municipality of Taytay.
Congratulations, Taytay Rizal. Well done. Now, for the most awaited portion, our winner for Kilos Komunidad Kontra COVID-19, who will also take home a whopping 40,000 pesos, is drumroll. Municipality of Del Carmen, Surigao del Norte. Congratulations!
Congratulations, Del Carmen, Surigao del Norte. Your community-based health strategy has stood out the most. To our other three finalists, Municipality of Higinto, Municipality of Mendez, and Municipality of Moncada, you will also receive 6,000 pesos each.
Congratulations again, winners, and of course to everyone who joined. To formally close this event, we would like to invite Dr. Portia Marcelo, Professor from the Department of Family and Community Medicine of the UPPGH, to give her closing remarks.
Hello. Magandang hapon po sa ating lahat. Muli, congratulations sa ating mga bayang nanalo. No? We began 2021 with much hope that the COVID pandemic would finally be controlled. Now we close the year also with renewed hope for a better 2022, a better normal for our country. Papuri po muli sa bayan ng Del Carmen, Taytay, Baliwag, Moncada, Mendez at Giginto at ang lahat ng 27 na sumali sa ating selebrasyon ng kagalingan at ng komunidad pamayanang Pilipino. The Community Medicine Faculty of the UP, DFCM, College of Medicine, and PGH is honored in at least two ways to have had Dr. Ray Hoson, Dr. Delan de la Paz, our co-faculty at the college and the hospital, who led us to this worthy initiative of Xavier High School and the Sigma Phi. We are also deeply honored to have met the 27 local communities and their leaders in government. Thank you for your stories. We are inspired to do better and produce the community-oriented doctors our Filipinos need. So this is a call especially for the Sigma Phi to continue what you're doing. 2021 is extra special because the Philippines finally won our first gold in the Olympics through Heidelin Diaz and our first Nobel Peace Prize through Maria Ressa. Maria Ressa called for facts and truth as the basis of our shared Filipino reality, to hold the line even amidst the dark forces against us. She ended her speech with the audience, the collective, the community, to imagine the world as it should be. A world of peace, trust, empathy, bringing out the best that we can do. And our 6 finalists today and the rest of the 27 communities who joined us showed that this can happen. Babangon tayo di lang sa bangungot ng COVID, kundi sa kawalan ng progreso. Babangon tayo dahil ang komunidad at leader ay kumikilos para sa ating inang bayan. Kilos komunidad, patuloy tayong maging malaya at mapagpalaya. Thank you again to everybody who joined us this afternoon and everybody behind this worthy program. Maraming salamat po.
Maraming salamat din po, Dr. Marcelo, for that closing message. Once again, congratulations to our winners. To everyone who attended, our judges, organizers, and most of all, our participants, maraming salamat po para sa pagtulong dito sa wonderful experience na to. More than the chance to win, we are all proud and thankful for being with us here and for showing your respective and community-based approaches against COVID-19.
So we hope that you enjoy this event and learn from one another. Once again, this is Kilos Komunidad Kontra COVID, brought to you by the University of the Philippines, Manila, College of Medicine, and Philippine General Hospital, Department of Family and Community Medicine, Mr. Sultan Pecheli Hoson, Xavier School Class 1996, and the Sigma Phi Sorority and Fraternity. Please stay for a short picture-taking session. Once again, I am Aliyah Arellano from the new Sigma Phi Sorority.
And I am BJ Mendoza from the new Sigma Phi Fraternity. Thank you and stay safe. For everyone, kindly please turn on your cameras. We'll have a quick photo taking session.
Good afternoon, everyone. I'll be taking
Hi, everyone.
1, 2, 3. One more. 1, 2, 3. Thank you, everyone. Thank you.
Thank you po.
Thank you, Doc Hans. Hello, Ma'am Portia.
Hello, everybody. Our judges, thank you very much. Congratulations again. Thank you, thank you, thank you.
Thank you. Bye-bye. See you in next
Director
meeting.
Pedro, do us proud.
Doc Portia. See you in ICU. Bye-bye.
Thank you. Bye-bye.
Bye, thank you.
Congratulations po, Mayor Aquino. Thank you po.
Thank you.
Thank you po. Nakakatuwa po.
Yes, it's an honor to be included on the 6 finalists. Thank you so much.
Thank you po, Mayor.